This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about a common pickleball elbow injury, elbow tendonitis, specifically on the outside of the elbow. If you like this video, we put out new content weekly, so please like and subscribe. So I guess you could call it pickleball elbow, as pickleball is getting more popular, but really historically it's called tennis elbow, or the medical name is lateral epicondylitis. What is it exactly? It's all the tendons that do this, that extend your wrist, all insert on this one little area, or mostly insert in this one area called the lateral epicondyle, and that can sort of get inflamed. It's not so much inflamed, it's more degenerated. It's like if you had a rope and the rope got frayed, and that causes pain in that area. So it's not actually in the elbow joint, it's outside the elbow joint. It's a lot of repetitive wrist extension, that's why they call it tennis elbow or pickleball elbow. And then if you can actually get on the other side from doing this movement, which they call golfer's elbow. You don't need to play golf or tennis or pickleball to get one or the other. That's just where they generally are seen, and that's why they're called that. So if you have that, what do you do about it? There's a few things you can do. One is rest, but obviously if you want to play a lot of pickleball, that's going to be hard to do. Another is you just want to do some gentle stretches to get those tendons moving. That'll help. Some people will get a brace and it's just a strap that goes over here. It's called a counterforce brace. What that does is it's supposed to make it so the muscles aren't straining that tendon as much by kind of pushing them down a little bit. Those work okay. There's all sorts of modalities you can use. When just someone comes to me with tennis elbow or pickleball elbow, I guess we're calling it now, I'll actually inject it with steroid, and that tends to get rid of it most of the time. I mean, tennis elbow is one of those injuries that's lingering and it can kind of come back, so it's not uncommon for me to inject it a couple different times. It's a different sort of technique where I have to poke with the needle a lot in the side of the elbow, and that basically causes the whole thing to scar up and heal. You can also use PRP as well in that area. But that's generally what you do. Very rarely you have somebody operate on it, where basically you scrape that part of the insertion of the tendon that's kind of worn away, or that part of the frayed rope. But generally speaking, it's an annoying injury. It's a lingering injury. Sometimes it takes a couple rounds of steroid injections to get rid of it. Very rarely it needs surgery. So I hope I was able to answer your questions about a common pickleball injury in elbow tendonitis, specifically pickleball elbow or tennis elbow. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond, but I can't give you any specific medical advice about your condition because this video and all my videos are for educational purposes only. Thanks for watching.